Fibromyalgia is a chronic pain disorder that affects as many as 10 million Americans, mostly women. Until recently, many doctors considered it a psychological disease. But now that the FDA has approved a drug to treat fibromyalgia, many patients say they're getting the help they need. NJN News health and medical correspondent Sarah Lee Kessler has the story.
Okay, tender or pressure?
Tender.
Okay, tender or pressure?
Pressure.
It's been 5 years since Anne Marie Appleton was diagnosed with the chronic pain disorder, fibromyalgia. It took doctors a decade to get the diagnosis right.
They kept looking for lupus and Lyme disease and rheumatoid arthritis and trying to treat those things.
Now Anne Marie says with a proper diagnosis, she's finally getting pain relief from a drug called Lyrica.
The relief from the pain is really substantial.
Lyrica was initially approved for epilepsy, but last June that approval was extended to fibromyalgia.
It's revolutionary because it's the first FDA-approved drug.
Dr. Benjamin Nadelson, a neurologist at UMD&J New Jersey Medical School, is an expert on the disorder. What is fibromyalgia?
Fibromyalgia is widespread pain that lasts months and is accompanied by tenderness when the doctor palpates the body.
Dr. Nadelson has co-authored several studies on fibromyalgia, including one that shows changes in the brain's perception of pain. He's also written a book called Your Symptoms Are Real. What do you say to doctors and others who say that fibromyalgia isn't real?
Well, you know, that makes steam come out of my ears. We're not taught in medical school to judge a patient by what he or she has. We're taught to reduce suffering. These people have pain that reduces their activity, that interferes with their normal activities of daily living and quality of life. They're sick.
The hope is that Lyrica and 2 other drugs that may be approved later this year will legitimize fibromyalgia, just as Prozac brought depression into the mainstream. Sarah Lee Kessler, NJN News, Newark.